reason the Health Association originally was set up was there was a lot of glue sniffing on the estate, and a young child had died at the back of the shops. So people got together and set the Health Association. At the time it was called the Health Hut. It's very important that we are able to continue the type of work that we do on this estate for the benefit of the estate and for local residents, because for some of them this is the only outreach they have. The projects we run come from the local community. It's not just things we pick out off the top of our hat, it's about what is needed within our community. I'm Carol Casey, I'm the chair of the organisation. I've been here now for about 15 years and I'm a local resident. The kitchen for us is really valuable for the estate, really. And the foot care service, that is so valuable for the people on this estate. You know, even just the state of some people's feet, they can't afford the prices of having foot care, and to be able to come here and receive that foot care is all about health and making them people feel good.
My name is Mrs Mancini. I lived in Knowle West 40 odd years.
My name's Ruth Hamlin. I'm a foot health practitioner and I've been here for about 18 months now.
Think about it.
Up a plan to provide subsidised foot care for people who possibly wouldn't access foot care at the standard rate, because it is quite expensive.
I first heard about it from a friend of mine who goes to another club, social club, and Ruth had come to the club to give a talk and hand out leaflets.
The vast majority of the people that I see are over the age of 60. It allows them to stay mobile. A lot of people find that they can't get down to their feet, and their feet end up in quite a sorry state. I've seen people who haven't had their nails cut for 12, 18 months, and that's actually not that uncommon.
Well, it made me come well because I got 5 feet. So I came to get my toenails sorted out.
I like working in the community. I think you get a huge amount of extra knowledge about people when you work in their own environment. People are more themselves than in hospital. I like to see people coming back and say that actually, they haven't had any pain.
It's not still. That's why he's got gout.
He hasn't.
Yeah. It would be most inconvenient if the activity didn't take place in Knowle West. Where else are we going to go? So we're paying one, or else somebody comes to the house, which again you pay more money. This is the only one local for us, or Brislington, which again is a bus ride away.
I think it's a really positive thing for me to be doing, and it's a worry that the funding possibly won't be there in the future. One of the things that we might have to look at is limiting, sort of setting new criteria for who I can see, and that's going to be difficult because people are going to miss out. And I think now the service is up and running and has been so positively received, it will be a shame to have to tell people that we can't continue.
And the creche offers many children many opportunities for different types of play and experiences for children that come to the creche. We look to enhance all areas of their development, really, their social development, their communication skills, their physical development, their academic development, all areas really that they need to learn in, we hope to enhance. And we do that by hoping to offer a wide range of toys and activities and experiences on hand. By the fact that they play with other children, that's encouraging their social skills, encouraging their language, they're learning about sharing, this kind of things. And obviously by playing with toys, that's how they learn.
Bring my child to the Knowle West Health Association creche because it just gets her out. She enjoys being independent from me, and we go to groups every other day of the week, so it's nice for her to do something on her own away from me.
Well, personally, I'm a sick children's nurse, but we're working with different girls that have got different sorts of qualifications. KWHA and KWHA are organisations which run training for nursery or creche workers at different levels. So most of the staff here have got a formal childcare qualification.
I think it definitely helps people in the area because through this group I found out a lot more that goes on in the community. I've met people that I wouldn't have met otherwise.
So obviously the mums benefit from the fact that they're doing maybe a training course or a self-help group, something like this. I think they also benefit from the fact that some of the time they're away from their children for a couple of hours, so it gives them a bit of space on their own to go and have a cup of coffee or go and see friends, go and do some shopping, like this the one tagging on all the time. So I think there's quite a few benefits.
The pop-up cafe is based around healthy cooking, so we do this once a month where we run the cafe to the public and we provide healthy meals that we make from scratch. There was a survey done not so long ago, and I think Knowle West, there's a high proportion of people who are obese in this area, so it's a key issue that needs to be tackled. So
I've worked in Knowle West for almost 6 years now. And most of the food's quite greasy, like you've got chip shops, you've got kebab shops. And for me, if I could find somewhere to eat healthy, I would.
In May, we started doing the cafe, and we've done it once a month since then. I've actually been with the organisation since September last year, and it's just something I just thought it would be a good idea, a good way to get people into the organisation and just actually ways of meeting the community as well.
And it's saving from getting in a car and then driving offbeat, going somewhere else to get a sandwich where, you know, if he's here, it's on my beat, it's walking distance. Good opportunity to come and sit down, talk to some of the people and find out what's happening. Knowle West Health Association lost their funding. I could probably speak for myself that we will probably lose that out as an organisation because, like I said, the Health Association has helped us quite a lot.
My name is Graham Blacker and I've been Treasurer at the Knowle West Health Association since 1996. In the beginning of this year, 2010, we were recommended by an organisation for the work that we have done on the estate because we're one of the longest running organisations that work on this estate. Then we had a visit from the Lieutenant of Bristol. Then 4 of us went then to Buckingham Palace to the garden party in July. And then on the 3rd of October, we were presented with the award, which you see in front of us, by the Lord Lieutenant himself here at Filwood. It means a tremendous amount, for the work that we have done. It is a great honour because it's equivalent to the MBE for a person, and it's very rewarding to us. We feel greatly honoured to have received this.
A tiny bit more oil in there too. There's so many kitchen courses that interest absolutely everyone. Today we've just finished something called Tasty Takeaways, so it's teaching people how to do takeaways healthy. In a minute I'm doing something called Ready Steady Cook, and it's all about cupboard ingredients, so it's about what you have already in that you can build from. So today we'll be doing risotto.
I've been coming about 2 weeks now. I think, on the whole, yes. Yeah, I've learnt new ways to do things, and I've tried some of the recipes out. And
I think it helps bring people together, and especially families that aren't communicating properly. Sitting down and eating really helps their family network.
Yeah, that's the spicy one. There's not too spicy, but good.
You spoke to someone earlier. That was a fairly mature lady, and she's just retired, so she's now, after 40-50 years of her life cooking, I'm showing her different things to do.
And we did a Caribbean dish which I tried at home as well on the weekend. I done it myself, and I think that's the sort of thing that help people to sort of change, and it's healthy eating.
The ladies that were coming here earlier have difficult children that don't like certain things, and I'm showing them how to introduce them into their meals. and actually they're coming back and telling me stories of how they've done it or how their children are now helping them cooking at home.
I've been attending 21 years. I started the second week it started.
I come from Knowle West and I've been coming here about 7 years, maybe a bit more.
At the moment we have 45 members. 565, 2 and 3, 23.
It gives me a break from the children, and a lot of the other members don't really go anywhere else on a Tuesday, so this is the only place they come for a bit of company, and you know, they like their bingo.
It's good that they can get out and chat and have a cup of tea and play bingo. Not everybody likes bingo, but the people that come here do.
Just staying afloat, really. That's what we're really trying to do, is stay afloat. We would like to be able to grow our own veg that we can actually use within the kitchen, and probably sell the produce to local residents as well. So